afternoon. My name is Kelly Long. I'm your Ventura County Supervisor, Board Chair, and District 3 Representative. Today is a monumental day, and thank you for watching our press conference. As you know, this is our usual COVID-19 update, but it's more than special because today we are administering our first vaccines. I will make sure any information on our COVID-19 updates can be received at VenturaCountyRecovers.com. So please go there for testing information, guidelines for businesses, tips to do at home for cleaning, and please make sure you're washing your hands, wearing your mask, and socially distancing. As you know, if you've watched our Board of Supervisor meeting yesterday, our hospitals need our help to make sure that they can take care of those that need it. And they're asking for everyone to not be socially gathering and spreading the COVID-19. So I just hope that you all will do your part in doing that, because our healthcare workers need us right now to help them take care of our community. Mr. Rigo Vargas is going to go over our numbers and the severity of our COVID-19. Karen Beatty of our RN is our senior hospital systems. We'll be talking about our vaccines. We also have Dr. Robert Levin, our public health officer, that will be here talking more information about vaccines and what to expect. And then our very own Mike Powers will be wrapping it up for all the other items associated with our COVID-19. Now, yesterday we did have a very long board meeting. You can go to ventura.org/BOS to hear all the updates from our COVID-19 of the different departments. But today we are here to talk vaccines. And we have Julia for Adventist Health in Simi Valley Hospital that's going to get her first vaccine. We're going to have Gavin from our Ventura County Medical Hospital and Santa Paula Hospital get his. We have Pillar, who is our Community Memorial Hospital, Ojai Valley Hospital, and also Dr. Bhatia for St. John's Medical Hospital. And I would like to say thank you to each and every one of you to be here today to show our community how easy it is to get the vaccine and how important it is. Our first responders, those are critical workers, really need to get this, and so we're excited to be launching this today. Our hospitals will be having this vaccine, and will be more information on it. So please say thank you to all of our critical care workers. Do your part with our COVID-19 and have a very happy and safe day. So with that, I'm going to bring on Rigo Vargas, our Public Health Director. And thank you on behalf of the Board of Supervisors.
Thank you, Chair Long, and thanks everyone for being here this afternoon. Rigo Vargas, Public Health Director. So today, as Supervisor Long said, it's a momentous occasion, very important in the fight against COVID. Yet I also have some very sobering news to share with you with regard to our cases. First is our cases. We're reporting 497 new cases of individuals affected by and having COVID. COVID in terms of at least having the virus, not necessarily having the symptoms, but nevertheless, very important to point out that our cases continue to increase. So with this continuing increase in cases, we have quite a ways to go before we see improvement in our other measures, both hospitalization and with regard to deaths. Before I cover a little bit more information on hospitalizations, we are going to be reporting also 2,309 newly tested Ventura County residents. Our average is now close to 800 Ventura County residents on average that are getting tested per 100,000 residents. That is just an amazing number, an accomplishment of all the hard work that is taking place with the Ventura County family, with increasing capacity for people to get tested. Yes, we've had some challenges with supply and demand, but we're making improvements. And again, almost getting 800 residents tested per 100,000 resident is among the top in the state. Now turning over to perhaps the two most difficult information to share with you is that we are reporting 3 additional deaths. They involve age ranges from 61 years of age and older, 2 females and 1 male, and all had comorbidities. But please be reminded that not everyone that is seriously affected by and has COVID as a disease gets ill enough, but those that are getting ill are in our hospitals, and several are dying, unfortunately. And our hearts, thoughts always go out to each of those families, which now involve 204 Ventura County residents that have lost a loved one, in part due to them having COVID. Lastly, in terms of the information that I'll be sharing with you, it has to do with our hospitalization numbers, which are of a great concern. Today we have yet another record high of both those COVID individuals that are in the hospital, getting excellent care by any one of our 8 outstanding hospitals, and they're very dedicated staff. They're really the heroes, and some of them are represented here behind me. They're working long hours, they're exhausted, and so we need everyone to continue to adhere to all the stay-at-home orders so that we can finally turn the corner with these numbers. But 241 are currently in our hospitals, 241 residents. Yesterday was a record high, 225. On Friday, we had 155. At this rate, we're probably going to be reaching 300 soon. And when, again, just last week and the week before, we were in the 100s. So this, I think, is a testament, a reminder of the seriousness of COVID. Also record high, unfortunately, is the number of those that are in the ICU. That is 59. Yesterday we reported 56, and on Friday, for a comparison point, we had 47. So both of those numbers are of the most concern. And also I would say that just as equally of concern is the fact that until we see an improvement in the cases, we don't stand to see an improvement in our hospitalization numbers. Hospitalization numbers are what we call lagging indicator. First, you need to improve the number of cases that are occurring in the community before you start seeing improvements in the hospital. That is because it takes 1 or 2 weeks for people to once they get infected, to develop symptoms, and symptoms enough that warrant them needing medical attention in our hospitals. So we're in this current surge. We're not seeing any signs of a flattening of the curve for either new cases or hospitalizations. So while it is again such an important day today to be able to show that there is light at the end of the tunnel, but it is not immediate. We're in the middle of our surge, and before the vaccine is available for the general public, it is months away from now. The earliest would be probably April, May perhaps, and so we can't rely on the vaccine alone. It is a great tool, but it is in short supply, and it'll be coming to Ventura County as all other counties in a phased approach, small quantities, and it'll be geared towards those folks that are on the front lines providing care for those that are being affected by COVID, as you are seeing today. And so again, I just urge all Ventura County residents to do all that you know is needed to flatten the curve. We always talk about those public health measures, and so I don't need to repeat them, but please adhere to all those guidelines, adhere to the stay-at-home order. As you know, we were to be in this stay-at-home current order for a minimum of 3 weeks, and the way it's looking right now, it's going to be much longer than 3 weeks. So please do all that you can to help each other, help your neighbor, your family member, help your businesses, support them still, but we really need to do better as Ventura County residents as a whole in order to improve these numbers so that we can further open up Ventura County, both businesses, more schools, and other sectors that are greatly impacted with the current surge. So With that, I want to introduce now Karen Beatty. She's part of the EMS and public health team that is co-leading some of the efforts along with Bev Hansen with regard to today's efforts that we have now the vaccine, and it is our first day that we are administering it and making it available for first responders and those that work in the hospital. So with that, Karen, let me just wipe down this area.
Thank you, Rigo. I am Karen Beatty. I work for the EMS agency. I'm a registered nurse. I've been working for the county for 20 years. So this day is very exciting for us. It's very emotional. We have been waiting a year for this to come. And we have worked tirelessly over the last few months. A great task force, COVID task force put together with the help of Bev Hansen. Back here, our operation manager, and Eva Reeder. We've had numerous people all the way from the CEO's office all the way down to our clinical supervisors and our education and training assistants. So it's been a great team effort here in Ventura County. Today is going to be the start of what we hope will be the end of getting COVID-19 out of here. So I'm going to tell you a little bit about what we've been doing today. We have our volunteers, Dr. Batia, Pilar, Gavin, and Julie, and we thank you guys for coming. We've been upstairs and we've got them all registered on PrepMod, which is the state register system. So we've got them registered. We gave them some phone apps to join. One of them is called vSafe. And vSafe is hooked up with the CDC. After they get vaccinated, the CDC will be reaching out to them every day for 6 days in a row to find out if they're having any type of reactions, a headache, fever, anything like that. Then they will reach out to them once a week for 6 weeks. So that's very nice to have reassurance that the CDC will be checking in with them. The other app is called VaxText. And this is another app you sign up for, and it will send you reminders of when your second dose is due. The other thing is they'll be getting a card today that'll remind them of their second dose. And all these things are the same thing that will happen to any other person that gets the vaccine. So you're offered those 2 apps you can sign up for. You're registered through PrepMod for the state, and then you get your card for your second dose. The vaccine has been drawn up, and we thought it out earlier today, and we reconstituted it with the normal saline. We have 6 hours to give those doses. There's 5 doses in a vial, and we have drawn those up and ready to go. We don't want to wait the whole 6 hours, obviously, so we're going to get started on that in just a minute. I also would like to introduce the nurses that are providing the vaccine today. Eva Reeder is our manager of the clinic system and the TB clinic. And we have Hannah Edmondson, who is a public health nurse that works in our communicable disease department. And myself, I already told you about me. And then we have Megan Steffi, who is going to be administering Julie, and she is our director of nurses for public health. So we appreciate you guys coming out to do this. It will be 0.3 mLs. It's just a little under half of an ml that'll go into the deltoid muscle. And that's about it as far as I can see here in my notes. So I will turn it over to Dr. Levin at this time. And I guess, are we waiting for the speakers, or do we give the shots now? Go ahead and give the shots, okay? So let me clean this up first. Okay.
Good afternoon, everybody. This is indeed a momentous day in our county. and we are, in fact, seeing the light at the end of the tunnel now, but we are still in that tunnel. We're in an intense surge. When I think of the situation we're in, I think sometimes I look for an analogy, and the analogy that occurs to me is being England locked in a war with Hitler in World War II, and how England must have felt when the United States joined that battle. We've been fighting this virus, but using only the worst, the roughest of tools to fight it with. But now we have a sophisticated tool, this vaccine. So I wanted to also touch on something. As long as we're seeing these immunizations being given, the question arises, will these people need to wear masks anymore? Will they need to socially distance anymore? And let's go through this piece by piece. For about 10 days, for sure they will, because it's going to be about 10 days before they have immunity in their body. But on the other hand, if immunity was perfect after one shot, they wouldn't need two. So they're going to get their second shot on day 21 from now. And so they'll need to be wearing masks through that period of time. And then, of course, there'll be a boost from that second shot, but it won't occur immediately. It will take days. So let's figure for a month they'll need to wear masks. But how about beyond that month? Let's think of three different groups of people. Let's think of people who are vaccinated, as these people have been. Let's think of people who, and I think this is the majority of people, who want to be vaccinated, but are waiting patiently for their opportunity. And let's think of that smaller group of people who don't want to be vaccinated. People don't want to be vaccinated for a lot of reasons. A lot of them don't want to admit it, but they're afraid of needles. Some of them don't want to be vaccinated because they've never been vaccinated for flu, and why would they get vaccinated for this? Some of them feel that the vaccine's going to hurt them, and there's a lot of reasons for them not to get vaccinated. But imagine if these individuals and all the others, little by little, who got vaccinated, stopped wearing their mask and then went into a store. And that store said, you need to have a mask. And they said, I don't need a mask. I had my shot. Okay, fine. Come on in. What about that group of people that doesn't want to be immunized? How many of them would say, I've had my shot? And they wouldn't be protected. And they would go into that store, and they would endanger that big group of people waiting for their immunizations. So people are getting immunized here for two reasons. They're getting immunized because they want to be protected, but every one of them wants to protect others as well. So the other reason is a very practical reason, and that is if you're not immunized and you come in contact with someone who's got COVID, the organism gets in your eyes, your nose, your throat, and it grows up to big numbers. And maybe your body can control it, but maybe not. And if it can't, you get symptoms, and you can get very sick, as you know. The people who are immunized, however, who encounter someone with COVID, the virus still gets into their eyes, nose, and throat, but it does so in the same numbers as it does the unimmunized person, but it doesn't get to grow up big time like it does if you're not immunized. Instead, the body's antibodies that you've created against that shot you got now will just come right in and tamp down that infection. So you may have virus in you for a few hours or maybe a couple, 3 days, and in lower numbers of virus than you ever would have had if you had not been immunized. And it is still possible that these people will get colonized on a number of occasions with this virus, and we don't know yet if they can pass it on at those lower numbers that they've got. So there's the other reason that they need to be wearing masks and social distancing and everything else on that list of things that needs to be done. And with all of the bad news we've had today, there is one glimmering of hope. I look for predictive factors that tell us that maybe we're coming out of this. And there's one thing that I've been looking at, and it's called the doubling time. And that is how much you are increasing from day to day in terms of doubling the number of cases that are occurring. If how many days it takes to double the number of cases. There was a time when we were at 160. So in other words, if we had 4 cases per 100,000 people in our county, it would be 160 days before you could get 8 cases in our county. So things were going really slowly at 160 days. But as the number falls, 40 days, now every 40 days we're doubling the number of cases we've got. So let me review with you what we've seen over the last 9 days. I've got 6 points over these last 9 days of doubling time. The doubling time on December 9th was 43.3. On December 10th, it fell and got worse to now only 35.7 days to double our number of cases. Our doubling time on December 11th was 30.6. And over the next few days, it fell to 27 and then went to 31, which is not statistically significant, 1 point like that. But now another point today, 35. So our doubling time is creeping up a little bit, which tells us that the efforts of the people in our county are starting to take hold. These are still just 2 points heading in the right direction, but let's keep following this number and let's redouble our efforts to do what we're doing. And be patient, and you and I, when our time comes, will be able to get the vaccine. Thank you very much. Now I'd like to introduce the CEO of our county, Mike Powers. But let me clean up first, Mike.
Thank you, Dr. Levin. It is so exciting to be here today on this momentous occasion. We're kicking off our journey here in Ventura County out of this COVID nightmare. And how wonderful to see it begun with our brave healthcare providers that are here with us today, our doctors and nurses who are on the front lines of caring for our loved ones here in the community. And we also hear a glimmer of hope from Dr. Levin that the rate of increase is slowing. And that is good news, and as he said, that means that once again our community is heeding the call to action. We know you've been getting tested in record numbers. Well, it matters. We're identifying and stopping the spread. And you're following the guidance, and that's what's helping with these numbers. But it's also important that we see these brave healthcare providers here before us today, because as we've heard the numbers in the hospital are very high, 241. That is an extraordinary level. It's more than double what it was in our previous surge, of course. And our hospitals are doing an amazing job. Our 8 hospitals, private and public, working so well together. We have one of our hospitals represented here today, Darren Lee, CEO of St. John's and Pleasant Valley here. Just a great example of the partnership that we have here in our county and the work they are doing to eliminate or reduce the number of elective surgeries, to manage the discharges, everything they can to manage this surge in cases, and they're doing it. But the message they also say is they can't keep it up at this pace, because they'll be the first to say that it's these brave healthcare providers right here who are doing that work, and it's a strain on them. And it's not as though we can call to other counties or so for help like we have been able to before, because they're facing the same challenges that we are. So again, we're just so grateful here. It's so appropriate that we are kicking off this journey with the vaccines here that are incredibly safe and effective with our brave healthcare providers, and just keeping them in the foremost of our minds as we continue as a community to follow the guidance and turn the tide on this virus here in Ventura County. And just lastly, I'd say, we're in the holiday season, right? And I was talking to my 11-year-old son last night, and who loves Christmas, but he said he wasn't as excited this year. And I said, well, why is that? And he said, well, because we're not going to get to see family. And I said, well, I get that, right? And I love that he felt that way. But I said, we can connect with them in different ways. FaceTime, video, Zoom, concerts, plays, whatever it is. You put them on, and the family will love to watch it. And we'll explore new ways of connecting with our family this year. And that's the gift that we can give to our families in our community, is celebrating in these new and different ways. And last is the other numbers that we always want to continue to remember is our businesses. Our businesses are suffering. These are our family members, our neighbors. They've been there for us, and they're struggling right now. So please, as you're shopping, shop local, shop online. Gift certificates for services that you can't get right now, get gift certificates. It's such a great opportunity to help those local businesses who've been there for us in our time of need as well. So with that, Ventura County, we're excited to celebrate here with you today our journey. And please continue to take care and have a safe and healthy holiday season. Thank you very much.